All right, I see folks starting to join us. Wonderful. Hi, everyone. Welcome. Happy Friday and September, our first PFA Network meeting together in September. So glad to see you all. So glad you're here with us to launch our Building Bridges series today. We are so excited you're here. We have some wonderful conversation and dialogue and experience sharing coming up. So we're glad you're here with us and we're excited to get going. So again, welcome. On the next slide, we just have a couple of reminders about technology, I believe. Thank you, Libby. So again, just a couple reminders about helpful Zoom features. We will definitely be using chat today. So feel free at any point throughout today's conversation to use the chat box and chat in anything that you're thinking, feeling, any questions. We will also be sharing a couple of things and links in chat. There is also, there we go, I'm able to see so many faces. Hi, everyone. um, and then we'll also, you're able to see live transcription down there with the little CC icon, so you can click that. And then, of course, our reactions. And then towards the end of the call, we'll also have a couple of polls. So looking forward to that as well. All right, on the next slide. Thank you, Libby. So we have our agreements that we talk about with our PFA network events. And so this, I think, will be just such a wonderful experience to hear from so many and for us all to hear from each other. So why don't we lift up today being here now? So we have about an hour together, and why don't we all try to commit to just being intentional and focused and mindful with our time together and being here now for our Building Bridges series launch. All right, and the next slide, we will go ahead and dive into some introductions. So we have a good group here and we have a lot we want to cover. So if everyone wouldn't mind chatting in, this will be a great time to use our chat box. So your name, location, and one goal you have for the fall season. So fall is upon us, and I know a lot of us had a really toasty hot summer, so looking forward to fall. So thinking about a goal that you have for the fall season. I would love to see what folks are saying in chat, so please keep things coming into chat. A goal I have is, let's see, probably to crochet more. I've gotten into crocheting. I absolutely love it, but I've taken a little bit of a pause and I'm slowly getting back to it. But I'd like to make a couple of scarves and some things for the fall season. So that is a goal I have. All right, wonderful. I see lots of things coming into chat. So I hope everyone, if you would open your chat box so you can see what others are chatting in, that would be wonderful as we can all continue to get acquainted. But we are going to go ahead and move forward now. So our Building Bridges series, I know this is, there's been a lot of conversation. There have been a lot of meaningful conversations and even some events thus far where we have talked about inclusivity within the PFA network. And so our Building Bridges series, the goal is really to create that sense of belonging with PFA network. So we have such a wonderful network here, so many wonderful patient family partners and all of you who have committed your time and efforts and your voices to share experiences that will continue to help improve our healthcare system. And so we are really excited to raise up a lot of these experiences to create that sense of belonging within our own PFA network community. And so this is a launching point. We will no doubt continue to grow and to evolve, and we're very excited about that. But that is our purpose. So we are going to move forward now and dive into conversation. So we have three wonderful speakers who will get us started today. So we have Naomi Williams, we have Rosie Bartel, and we have Brandy Hicks. And I'm going to leave space for each of them to introduce themselves. But again, we are so excited today for Building Bridges. And I'm going to start, Naomi, with you. We'll turn it to Rosie and then Brandy. So Naomi, I'll turn it to you.
Thank you, Brittany. Hi, everyone. So happy to share this space with you on this Friday. I'm Naomi Williams, parent of Noah Williams, aka Noah's mom. And my why in this space has been because of our experiences that I encountered as a pregnant woman, the outcome that I've had with Noah, and that has um, gone forward in having been an advocate for other family members who have found themselves um, living with disabilities and not being heard. And so just coming to the space to not only share, but to learn as well, but learning how to better partner with systems and communities when it comes to seen and unseen disabilities. I think that's something I haven't talked about myself. And Noah, all know about, well, not everybody. Anyway, Noah, but knowing that as a parent caregiver, the mental health challenges that have presented themselves in myself.
Thank you, Naomi. And Rosie, I'll turn it to you.
Sure. And I'm Rosie Bartell. And basically, 15 years ago this month, I had a knee replacement that turned into a MRSA staph infection. And that led to lots of surgeries and hospitalizations and three major amputations. And I ended up in a wheelchair. And that gave me a whole new, another world of insight that I never had before. You saw people in wheelchairs, you sympathized with them, you empathized with them, but you didn't understand. And I didn't understand. And I definitely learned a lot. These days I look at it as my wheelchair being a tool of my trade, in order to help me tell my story and to tell my story with purpose and to share my lived experience. But yet many times it's hard to maneuver that wheelchair around people and help them understand what it's like to be in that experience. And the other thing that happened because of all the antibiotics I received and the kind of antibiotics, I also lost most of my hearing. And so many times when people, when people are asked to turn on their cameras or when I can't see people's lips, I can't always understand them because I read lips as much as my hearing aids help somewhat, but I read lips. And so basically I have seen and unseen disabilities, but yet I don't consider them disabilities. I consider them things I live with and I learn to function with. And so it's not a disability, it's who I am today. And this is how I go forward. Thank you.
Thank you, Rosie. And Brandy, we'll turn it to you.
Good afternoon, everyone. I'm really happy to be here today. So about 15 years ago, I was diagnosed with multiple sclerosis. And so over time, my symptoms started to advance a lot. Many ways, there have been invisible symptoms like nerve pain and anxiety, but also with the advancement came more visible symptoms, notably leading to limited mobility, with me having to use mobility aids to maneuver and get around. So I also want to note that several women in my family have MS as well. So their stories, along with my own personal experiences, like Rosie mentioned, just kind of opened my eyes to a number of things, particularly some gaps within the healthcare system and just the community overall, surrounding people with visible and invisible disabilities. And because of this, I'm just always looking for opportunities where I can leverage my experience to help improve healthcare access, especially with those who have complex health needs. And so since I've been engaging with the PFA network, it's really provided me a lot of opportunities to do this and contribute. And I appreciate just being able to have a voice a place where I can use my voice and feel valued. And it's really truly been a network. And I've been led to opportunities that I may not have otherwise been able to have. And so I just really appreciate that.
Thank you, Brandy. Wonderful. Well, we are so glad each of you are with us to share your lived experience with the rest of our community on this call. And so, Libby, if you wouldn't mind taking down the slides so we can all see each other and talk through a couple of questions that we have. And everyone else also on the call, as we are talking through some of these questions, please do think for your own selves as well, and put some of those insights in chat. We'd love to, again, have a community conversation. So I am going to get us started with a question here. And Naomi, I'm going to start off with you, and then Brandy will go to you, and then Rosie will go to you for this first one. So what does inclusion mean to your community?
Oh, that's a fabulous question. Inclusion to me means and looks like being thought of when things are being developed and or planned. So for instance, if a meeting is at a building and the entrance has stairs, and my son utilizes a wheelchair, it makes it difficult to access the location where a meeting is being held. So just having forward thinking of not everybody is physically able to participate in things. So that's what it looks like for me.
Yep,
Like
Brandy,
that.
go ahead.
I like that, Naomi. Just being thought of. That's great. Way to think about it. So, okay, as a person with disability, you know, often feel like I'm either left out or I'm forced to adapt and navigate a world that has not really caught up to the beautifully unique and diverse needs of the population. Like Rosie said, she doesn't see herself like as being having a disability. It's not really, it's not a us problem, it's a world problem. Like if things would be more accessible or inclusive, it wouldn't even seem to be the same way. So I feel like for me, inclusion for my community would mean creating an environment where everyone, regardless of their abilities, feel like they belong and they have the safe spaces that they need and the supports they need to live their full lives. And it also goes beyond just the physical accessibility or hearing aids or devices and tools, but also the cultural shifts and attitudinal shifts and changes around stigma, where people just feel like they're just treated as equal members of society.
And for me, inclusion looks like the fact that I, I guess I was always the person in the middle of everything. And so having to be on the outside, because if you're in a wheelchair, especially, I could maneuver my manual chair around people a little bit more than I can use my power chair. And so I feel like sometimes I'm on the outskirts. I'm always at the, at the last row or on the outside near the door, or on the last, on the end table. It's really, you now get to be in the middle of all of the people. As a friend of mine said, her sister, who was in a wheelchair her whole life, said she had a butt view most of her life, and that is so true. And I laughed when she said it, but then I realized that is very true in our lives. We look at people's butts and backs more than, because people get engaged and they're talking and they're standing and they don't realize that you are behind them, or that you're in a place that, and so inclusion for me is like when somebody turns around and gets to my level, that makes me feel inclusive. It rather than always waiting for me to figure out how I could maybe be in the middle of this mess, but help come to my level, and sometimes, and so that's how inclusion is important to me.
Thank you, Rosie and Naomi and Brandy, for sharing, and a lot of really important insights that you shared and things to think about that maybe I know I might not have considered. So thank you. Our next question, can you describe a time when you felt either fully included or excluded in the healthcare system due to you or your loved one's disability? And Naomi, we'll turn it back to start with you.
Yeah, so my son still goes, he's a minor, so goes to a children's hospital, and he's incontinent. And one of the things that we have found when we go to our outpatient clinics, that there's nowhere for him to be changed easily, because he's a teenager, right? So he doesn't fit on the baby changing stations anymore. And so it became apparent as he has gotten older that it's really hard to say that we're a children's hospital to care for all children when there weren't facilities that supported all children. So not even in the exam rooms, where they have short tables and they are stationary, they don't raise or lower. So that was one that has become apparent for us, and just being able to bring awareness in that regard.
Well, for me, one of the healthcare experiences that always comes to mind was my first gynecologist visit. Once I had started having more physical progression that was impacting my mobility. So the level of anxiety that I just felt around like having to go and how am I going to get up on this examination table? Am I going to be safe? How am I going to get my weak spastic legs in the stirrups? It was just so overwhelming for me. And just most people dread these appointments, this annual visit anyway. But just with this, this added layer of difficulty, it really would discourage most people from like going to their primary care visits or preventative care visits altogether. And I even contemplated counseling, but my former background is actually in public health. So I wanted to be a good steward of the preventative care measures and things like that. So I decided to call my nurse, the nurse, and just kind of share my concerns and ask her, like, what type of accommodations are possible? What can you do for me? Do you have adjustable tables? Like, what's going to happen? This is my first time, since these things have occurred. And so she was really reassuring. She heard me out and we came up with a plan and all that. And so I felt good about proceeding with it. And so I did go, and the nurse and the doctor, everybody was supportive. And luckily my very patient husband was able to help me through the process and I survived. But it changed my perspective forever. And that thinking about like all the courage I had to kind of garner to, move through it. And it just kind of left me wondering like how many people would forego these visits if they didn't know what to expect, and just going to simple things like the dentist and things that everybody should be able to go to. So it just was an experience that, everybody, all the areas, all the facilities are not equally as accessible. But I was grateful in that experience where the supports of the providers and even just being able to have my husband there was really able to get me through it. And I'm also pleased though to note now that gynecologist office does have adjustable tables in all of their examination rooms. So that's made a significant difference for me.
That is super exciting to hear, Brandy. I just wanted to jump back in real quick, if I may, and because I know I spent a lot of time talking about my son and his how we present in the world, and I'm finding it's important to share how I am showing up with disabilities, if you will, and I just wanted to share a positive from a, if you will, behavioral health or mental health space. Going and taking care of myself and going to see my primary care physician, and they know all that is going on in my life and the stressors and all of those things. And in one of the screenings that they did, like a depression screen, and I probably screened or scored very high, and where they said, would you like to speak to somebody? We have someone here, so after I leave, they can come in and they can talk to you, and we can have that conversation right there. So in the sense of, they took the screening, got the scores, recognized that I was having some challenges, not suicidal or anything in that matter, but just that I needed someone to speak with. And it was not having to book an appointment for 2 or 4 weeks later, but that there was someone that was available to speak with right now. And talking about having depression or anxiety is challenging. And knowing that they were able to support right then and there, I appreciated very much.
Thank you, Naomi, for sharing that. And Brandy, you too. And Rosie, I'll turn it to you for that question.
Well, for me, one of the things that I always talk about is the fact that I I get some of my care from, at least from my orthopedic specialist and doctor and surgeon at a large teaching hospital here in Wisconsin, and yet I have to book not only an appointment with him, but I also have to book the cast room so that I can go to the cast room where and be able to use one of their beds or their tables there that are low enough for me to get on and off of with my chair, and because his offices don't have that. So not only do I have to coordinate these appointments, I have to coordinate it for the cast room and also for my doctor appointment. And the other problem that is, because I have MRSA, many people so that everybody comes in gloved and to take care of me and mask and all that. And then everybody around me is whispering, well, why is she in this room? Why can't she be in his room so that we don't have to be exposed to, because they're all afraid that, if they don't, if they're going to catch it from the air, MRSA, because they don't understand it. But yet, it's just a kind of a rolling effect. Now, when I go to my primary care physician, it's really interesting because he has one table in one room that I can just slide over on with my slide board and then slide back to my chair. And so he always makes sure I get that room. And he, if I'm not in that room, he'll say to the nurse, Rosie needs to be in that room. Don't, make sure that she gets that room, or when, put it on her appointment for next time. So and I guess one of the other things that's happened to me, and it's kind of a funny story, but so that I worked on renovating the lobby of a hospital. And so, and this was happening before COVID and then continued through COVID. And then when I went to visit the first time, I thought that we had renovated things that they were all high, all of the boards and things that at like the coffee shop and that were high enough for anybody in a wheelchair could see it from their wheelchair. But what happened is they decided to put things in front of it so that when you pull up to the counter, there's this big tall cabinet or shelf in front of it. And so and I remember saying to the young lady behind the counter, do you have a paper menu or a laminated menu that I could see, because I can't see the board? And she said, well, but it's right there on the board. You can see it on the board. And I'm like, and finally I pulled over the facility guy and I said, go get yourself a wheelchair, put yourself in the wheelchair and sit next to me and see if you can see over that cabinet. And I said, and I say that to people all the time, put yourself in the wheelchair and spend some time in that wheelchair and roll around your healthcare facility and see what it's like for a patient to have to be in a wheelchair in your facility. And so I look at that as a positive, because, he did it and he realized real quickly that he couldn't see and there was a problem. So that's a positive to me, when people are willing to look at the problem with you and help solve the problem. That is always a win for me.
Absolutely, Rosie. I think that's a great point. I think each of you have shared the importance of advocating for yourself and your loved one. And sometimes it's very mentally exhausting because you're already going through enough in your own experience in that moment. But taking those extra steps to share that feedback or asking someone to, sit in your shoes and walk a mile in your shoes, that, type of saying is helpful, because it does help folks to shift their perspective and be able to have more empathy. And so I appreciate you sharing that, Rosie. And I'm going to stick with you, Rosie, because that leads us really well into our next question, which is, from your perspective, what are some of the key barriers people with disabilities face when accessing healthcare? And then what ideas do you have to minimize some of those challenges? And I think you've already shared one really great one of asking some of the healthcare professionals to, again, sit in your perspective and see. But I'll open it to you to share more thoughts on that. So Rosie, I'll start with you.
Well, things as simple as putting in, like when you're, at least when you're renovating places, don't put the push button, for opening doors, but put the wave in, because that's easier for a patient to do, and in that chair. Also, I have to tell you that the reason that I reached out to Naomi originally, and this whole, when we started talking about sharing our story, was because she wrote this beautiful story and about her experience one day in the bathroom, where she brings her own cot to the bathroom to change her son. And when I was in tears by the end of reading that story, and I was like, people don't understand. They don't know what Naomi goes through every time her young son needs to go to her teenage son needs to go to the bathroom. And that's the other thing, is people, many times, and even in healthcare facilities, the toilet isn't quite high enough, or the bars aren't right. I now work with facilities in many institutions, and from the ground up, with the architects, because they don't, they build these beautiful showers, the roll-in showers, but the seat is over here and the water is over there, and then the grab bars are over there, but they're not, you can't even reach the water, and it's that way in hotels. But you'd think, at least in our healthcare facilities, we'd make sure that those things were in a place that we could reach them. So I literally, have work with architects, because I think architects have the power of making sure that those things happen, especially architects for schools and for healthcare facilities. The other, so that's where I believe we have to start. We have to start from the bottom up. We can't, it's interesting, because I worked with an architect to build out a new ambulatory surgery center and specialty center. And I made it very clear that, not only do we want this for our patients, but we also want it for staff. And so when I toured the facility, I kept saying, I want to see the staff area. I want to see the staff area. But sure enough, they had the big heavy doors, no way of opening the doors. And so I said to him, I said, so when you hire a person with a disability, how are they going to get in this building? And immediately someone behind a desk jumped up. She was setting up her desk in this new facility. And she said, Rosie, you're absolutely right. I just hired a person with MS. And that person may not always be able to get in and out of this building. And they shouldn't have to come through where the patients come through. They should be able to come in where every other employee comes in. And so they went back to the table, and they put in the wave door openers and things, because those are the things that help us stay employed, help us be able to share our stories, and be able to be totally involved human beings.
Absolutely. Yes. Thank you, Rosie. More powerful examples of using your own story and your own voice to help create that change that we want to see. Brandy, I'm going to turn it to you next.
Okay, I want to try to add something because I have a lot of things around what Rosie was just talking about too, but I know I want to try to add something a little different, so we can see some different sides of it too. So one of the things that I have on my list of thinking about like some different barriers is around is would be more around like just the interactions with the providers as far as the training they might be needing around like cultural sensitivity for the disability community or just the different needs of patients and not understanding. So I'm just thinking about like just in general, some of the things I've experienced, but particularly the COVID-19 restrictions put a big strain on everything and everybody. We all know that. But having to go to the doctor without your usual support, if you usually have a caregiver with you and different things like that, and just having to rely on a stranger to maybe get you on the MRI table or and just like I feel like that was taken for granted a lot. And I didn't, I mean, COVID-19 didn't start that. It just like took a bigger light on it, shed a brighter light on it. And so I just bring that up to say that I think one of the barriers is just people's experience of just not their healthcare providers just not understanding or just not having a good experience dealing with their providers around whatever their needs are, whether and especially if they are invisible. I mean, like, or even if they're not, people just don't understand. They just expect you, they should be able to move you around like you're just a piece of meat or do whatever. You should be okay as long as you're here. And I don't think it's not okay. And like a lot of times I just kind of try to go with the flow, but I do have really, I can get really anxious. And so I think more training needs to be done with the providers and nurses and just knowing how to deal with people and what they may be going through and just the sensitive nature of that. And so a lot of disability awareness and education, I think really is the first step, actually. Before you can do any infrastructure, people need to understand why they're doing it. Like, why is this even needed and how to communicate with folks. And then another barrier that I see on another side would be around the fact that a lot of people with disabilities have multiple things going on. They have like it's a complex health issues that they're dealing with. And so they're seeing providers in a lot of different sectors and having how that information gets like melded together to complete the person's story. And some processes that we need to kind of come up in order to do that, because it's hard to always remember who you told what to and keep track of all of the different reminders and things like that. And I know this is an area Naomi is probably familiar with as well. But just things that we can do to kind of help make that experience and like create a thread between the different providers that we see to be able to like have an overall experience and treat the person as a whole as they're going from provider to provider.
Thank you, Brandy. Definitely some really important and helpful insights that you shared. Naomi, I will turn it to you.
Wow, I don't know what's left. I second what both Rosie and Brandy shared in the barriers. I think what it comes down to me, in the sense of, people fear what they don't know or understand, um, and biases. And so those are big barriers in the healthcare system. So, that leads into a lack of continuity of care, as Brandy mentioned. Even if you're going to the same place, the continuity is it's disjointed. I just did a talk for residents in North Carolina, and they requested their family medicine residents and had requested more interaction and knowledge from um, people with lived experience in the disability community, because they don't get that in their medical training. And so, when you talk about disability, the world is a barrier. um, when you're talking about typical life versus a disabled life, whether that's presents physically, or mentally, emotionally, um, from parking and having enough, parking places, as Rosie mentioned about doors. There's curb cutouts, um, yeah, medication, and medication errors, that arise. If somebody is, a G tube versus eating by mouth and those kind of things. So there are a lot of barriers, and I like to try and come with solutions. So to me, one of the things that could be used to improve access to the healthcare system by the disability community would be involving persons of various disabilities, from wheelchair users to visually impaired to hearing impaired, looking at a universal design. And a lot of times I hear that it's not cost effective, or it'll cost too much, or it'll take too much time. But if you look at it, if we actually create a space where everyone is welcome and is able to access it, it's going to make it better for everyone. The outcomes will be better for the patients, the family members. If you're looking at scores, those are improved. And just real quick, I attended a conference, and it was with the Christopher and Dana Reeve Foundation. And I walked into this space and I was like, there aren't a lot of, why don't they have any chairs? Or they're very limited in the number of chairs that they have. And I realized, so Christopher and Dana Reeve Foundation is dealing with paralysis, and individuals that have paralysis, whether it's a spinal cord injury or, some other form. But the room was set up for um, so many people who use wheelchairs. And it was foreign. It took me a minute to realize why the room was set up that way. But when it dawned on me, I said, oh my God, this is ingenious. Because you're not having to move tables, you're not having to move chairs to quote unquote accommodate somebody. The chairs aren't there. I had to go look for a chair. I was the minority in the space. So
Thank you, Naomi. Yes, thank you for sharing that example and walking through how that made you feel, but also then the enlightenment you had once you realized that. So thank you for walking us through. All right, we have our last panel question, and then we are going to get to some conversation with all of us here on the call. So, Brandy, I am going to start with you for this question. So, how does increased accessibility improve your life and your partnership efforts?
It just goes back to access, and so just being able to have increased accessibility was just, it improves the quality of life, I guess. Just being able to do things that you would normally want to do, or that because it goes beyond, like, to me, healthcare is critical. I mean, if you can't do anything else in this world, you should be able to go to the doctors easily and safely. And so we're talking about basic level, but just if we just improved accessibility overall, then it like opens up the doors and windows and everything of more opportunities for people to be able to just be active members of society. And I think, and with that will come along with improvements in just overall physical wellness and mental wellness, and all the things that I think sometimes go unnoticed and not even considered when thinking about this kind of stuff. Yeah.
Thank you, Brandy. Rosie, I will turn it to you.
Well, for me, it's like it takes the stress off. I mean, I don't have to stress when things are accessible, and I know they're accessible. It takes the stress off, and that stress is what I think Naomi was talking about. That worrying about how you're going to get from point A to point B, and those kind of things, and Brandy, the fact that people live in their own little silos, and you have to like be communicating your information from one person to the next person, and you don't always remember, so when those things work, and when they are accessible, and you feel like you are a partner in your healthcare, and you're a partner in your world, and the windows are wide open for you, then your life is less stressful. You sleep better, and you feel better, and your experiences are better. And that would be my ideal world, where we wouldn't have to always be advocating, but it would just happen, and you wouldn't have to tell people or ask people. It's really hard for me, especially to ask for help. I was like the helper, so it's hard for me to ask for help. And so many times I try to do things without getting the help, but yet it is so much easier when somebody offers to help.
Absolutely, Rosie. Thank you. Yep, Naomi, go ahead. I saw you jumping in. Yep.
Sorry. As you talk about improving the lives, it's not just the life of the patient that is impacted, but the life of the family members, potential caregivers, as well as the staff. And I would say, when there's when there's inclusion and the improvement of accessibility, it decreases the anxiety and the frustration that presents, which means if I have less frustration, my nice factor goes up. I have more capacity to interact and not be short, which impacts staff too, right? And the other part to that is where I can trust the system. I just had a situation now, like my son uses a wheelchair, and whenever we go in for weight, it's, we need to weigh him, and they don't always have a wheelchair scale. So then just moving forward, from the last time that he's weighed, so that's one issue, but then also looking at height and weight, and his height is never taken because it's not easy to do. So then when you're looking at the growth chart, so like you have these standards that everybody is bucketed into, but we don't fit that standard. So use the parameters that fit where we are. So when accessibility and when there is improvement, my trust factor goes up. When I see that there is intentionality, um, then I'm able to step back and breathe and not question everything and say, okay, you really are considering us. So
Thank you, Naomi. Yes, that is very important. I see in chat the nice factor, and that is very, very true. And especially I know for myself as well with my kiddos and things that are going on. So yes, thank you for sharing that. And I want to go ahead and open it now. We have about 15 minutes left. We have 2 polls that we want to pull up, but just before we pull those up, I would love to hear from you all on the call, something that you heard that you learned from Naomi, Brandy, and Rosie, that you learned, or something that struck you or really resonated with you today. I'm so thankful to each of you for sharing your experiences and your hearts with us today. This is, the vulnerability is so meaningful, and I really appreciate it. And these types of conversations are what matters and what helps us push the work forward and get to the change that we do want to see within the healthcare system and really the world. So thank you all. But I will pause for a moment and see if someone would like to speak up and share something that resonated or that you learned today. Lori, I see you put something in chat. Would you mind coming off mute and just sharing with us quickly?
Sure. As a parent and caregiver of a child with multiple challenges, it was just a breath of fresh air today to hear stories that resonated so much with my own. I often feel very isolated and very alone, and that the work that I do as an advocate doesn't always feel like it goes very far, right? And I advocate very much on behalf of children around our state. So it was like the whole changing table thing. Like, I work for a pediatric healthcare system, and I did everything in my power to make sure we would have accessible changing spaces. And we have them, but they could be so much better than what they are. And it was just kind of like, well, how much more can I possibly do? I'm only one voice, but I tried getting other families to come forward, and we did a petition. I mean, like, how much more can you possibly do to make sure that people are listening? And there's only so much that you can do. So it was really good to hear these other stories that resonated. I mean, there was some from Rosie's story that resonated with me, some from Brandy's story that resonated with me, and some from Naomi's story. And it was just like, yay, we're not in this alone, and other people are out there, and it was just beautiful. So thank you all.
Thank you so much, Lori. Thank you for sharing that with us. I know that feeling well of that isolation and feeling that especially as a mom and supporting my son through some things. So I know that feeling. So I appreciate you sharing that with us and being here with us, for all of you taking the time to be here with us. These conversations are so important for our community and in a lot of the partnership that we're doing. So thank you.
And Brittany, can I say something really quickly?
Yeah,
So what Lori
absolutely.
said, because that just
Mhm.
brought up something else that I had thought about as far as like being like why being inclusive is so important, because like when thinking about feeling isolated or just lonely in whatever you're going through, or if you whether you have a disability, you feel lonely in that and you don't feel like people can understand, or if you are a caregiver and or a person or partner of someone with a disability and you don't know who to talk to because you don't want to make the person feel whatever. I just feel like when we have more conversations like this, or when we do see efforts where it's more talked about or things are more accessible, it helps to alleviate some of those areas of as well as feeling alone or isolated and things like that. And I feel like that's just a really important thing for us to consider as well, because isolation and loneliness is a whole nother bread or beast in this that we didn't even really touch on too much today, but I definitely know it comes up a lot.
Absolutely, Brandy. Yes, thank you. And that's a really great point. I want to make sure to say as well as today's Building Bridges series is a launching point for us. And so we want to definitely continue to have these conversations. I know there are different topics related, topics under topics related to what we're talking about today. And we don't want anyone within our PFA network to feel alone or to feel isolated, even if those are natural occurring feelings that we have each other. And so we want to continue these conversations, whether that means, meeting separately now and again, finding a cadence to get together to talk. We have our forums that we created a Building Bridges space, and one of my team members will drop that link in chat in just a moment, but we can share links, we can talk with each other there, and just continue to reach out. We are a community as the PFA network, and we want everyone to continue to feel that way. So thank you for bringing those pieces up. And I do see, first of all, Karen, thank you so much for putting that picture in chat. You and Rosie looked wonderful, and so glad you all had a chance to connect. And Claire, I see that you also put something here about isolation and loneliness in chat, and that's something that I think we can definitely continue to cover because it's incredibly prevalent in our society these days, I think maybe more than ever. So let's make it a point to continue to think of a meaningful way to cover that. But thank you for adding that there. So I do want to make sure that we have the opportunity to do our 2 polls, because we really want to let this conversation be a jumping off point for more engagement and action for us all. And so we're going to start with our first poll, but the 2 questions that we have, and I will read the both off right now, are really a call to action based on what we discussed today and what we all can commit to continuing to do. So first question is, based on what you heard from our speakers, what is one thing that each of us on this call can do to support the disability community? So thinking about that, and then our second question will be, what can we as the PFA network do to better encourage inclusivity and support? So we'll bring up those 2 questions. We'll start with the first one. And if you can each just take a moment to type in and just let us know your thoughts around this. So we'll take a few moments for each one to give everybody time to just mindfully think about this, and we will circle back on these. So I'll just mute for a moment, give everybody a couple minutes to think through and input some answers. Wonderful. I see about half have responded, so thank you. Keep those responses coming. Greg, I see some links that you're putting here in chat for us. Thank you so much. These are definitely helpful. We can make sure we add those to our Building Bridges space too on our forum, so others can be able to access as well. But we are going to, so take about few seconds here to wrap up if you're typing, so that we can, I don't want anyone's poll input to get cut off. So if you can wrap up in the next like 5 seconds or so, and then we will share. So yes, Libby, thank you. If you wouldn't mind. Can you see? I see head shaking. I think mine looks a little different. So
Mine does too. So
Okay.
can you see the results?
It just shows my own response.
Yeah, same.
Yeah, it only shows mine.
Oh,
Oh, interesting. Okay, good to know.
okay. Well, while I try to figure that out.
Yep, you want to open poll too, Libby, and then
Yeah.
we'll thank you.
Okay.
While she's opening that, I was going to mention, because Anthony and I had a conversation a couple weeks ago, and he talked about helping people understand how to travel with a disability, and the anxieties, and how do you deal with those, and so maybe at some point we could do that, to do a presentation about how to deal with traveling and being in person rather than just virtually. Virtually is wonderful, but there's something about being next to people and being hugged by people again, and all of those things are important to people with disabilities.
Thank you, Rosie. Absolutely. And it's so important, whether it's, state to state travel or local travel, it's a lot to think about and consider. So that's a really a great topic. Thank you. And thank you, Anthony, for raising it. All right, poll 2 is open, which again is, what can we as the PFA network do to better encourage inclusivity and support? So if you have thoughts there, I see some answers starting to come in. So thank you so much. That's really wonderful. I think just to, again, have the space and the forum to have these conversations, because I think inevitably we're learning just, again, from another person's life experience, and it helps to kind of open our eyes. It helps the next time I go to my doctor's appointment, I will definitely be looking and thinking of the things that I heard here today. And I think that in itself is really important. As we're hearing and learning from each other, we can think about different ways that we can all let our voices be heard in the healthcare system, whether it be our experience or not. We can share some of the experiences from others in this community to be able to pass that forward and hopefully to make those improvements. All right, a few more seconds if anyone is wrapping up poll number 2. And as always, if you think of something or something comes to mind, you can definitely reach out to me by email. As I said, we definitely want to keep these conversations going. So reach out if there's anything, again, that you think of or that you'd like to share, because we just want to continue to keep these conversations going and creating the space for all of us within our PFA network community. All right, I think we have a good number of responses here. So let's see. Libby, if you wouldn't mind just sharing so we can close this poll and sharing just the forum slide for a quick visual.
Okay.
Thank you, Libby.
I'm working.
Lots of clicks at the end of the call, right? Okay,
We're
so
a
just
team
a
over here.
quick reminder, and we put the link in chat, but we do have the forum space, and I know there's a question on there that Naomi posed to other parents, and there's links on there. If others on this call, if you all have helpful links or something that you'd like to share that you feel like could help us all, please do share. So just a reminder that once you click that link in chat with the forum, it will bring you here, and we'd love to just keep the conversation going together. So we just wanted to show you this is what it would look like when you're on there. So just a quick reminder. But I know we're right at time. I know folks have other things to get to, but thank you all so much. Thank you so much to Rosie and Brandy and Naomi for just sharing with us, being so vulnerable. Everything was really, really lovely and wonderful and powerful. And we're looking forward to more forward momentum. Libby, did you want to say anything to close out?
I did. Great job, Brittany, putting this together and bringing our speakers together to share your lived experience and just create awareness. That's exactly what we're, trying to do. Create awareness, reduce isolation, create belonging within the PFA network. So just also wanted to hold space for anyone who is interested in continuing the conversations within this community. If we can support you with a Zoom meeting or what have you, we would love to see members of the PFA network kind of move forward with staying connected and continuing these conversations and supporting one another. So happy to support anyone who's interested in sort of taking the lead to develop even more space for conversation, even outside the forum. So happy to do that. Just wanted to make that offer.
Perfect. Thank you.
Is that
All
a matter
right.
of just connecting with you, Brittany? How does
Yep.
that happen?
If you're interested, please do reach out to me and I will connect with my team and we'll figure out how to make that happen. But yes, please reach out to me and we can continue the conversation. All right. Well, happy Friday, everyone. I hope everyone has a wonderful rest of your day and a great weekend. And we will have a coffee chat next month. So we'll see each other again in October. But thank you all. Reach out if you need anything.
Have a great weekend, all.
Thanks. Take
Thank
care.
you.
You
Bye,
everyone
everyone.
for being with us today. Thank you.